Hi guys, Dr. Silver here with True Dental, and today we're going to be talking about what to do and what to expect after you've had a tooth pulled or had some other kind of dental surgery. So when you leave our office, you're going to be given a little goodie bag. Inside of your bag are going to be all of your instructions. Please read this over. I know we're reviewing it again right now, but it's all right here for you. And you're also going to get some extra gauze. So this sheet here really does a great job going through exactly what you need to do and how to make sure that you have the best recovery that you can over the next few days and through the week. So right after the extraction, you're going to leave our office. You're going to be biting down on some gauze. It's that firm biting pressure that's going to initiate the clotting and the cessation of the bleeding. So when you get home or in about 30 minutes, go ahead and take those gauze out and then take a look at them. If they're super saturated with blood and just that deep red color, roll up some more gauze and even wet them just a teeny bit, and then again, firm pressure and bite down. You want to repeat this process about every 30 minutes or so until it's just a little bit of a light pink on your gauze, and then you're done with that. Keep in mind that the extraction site or the surgery site could still ooze a little bit of blood throughout the rest of the day. When blood mixes with the saliva, it can look like a lot of blood, so don't let that freak you out. One of the things that you want to make sure that you do is try to avoid a dry socket. So as the healing clot is forming over that extraction site, it's super important for the future formation of bone in the healing process. And if you were to lose that initial healing clot, you get what's called a dry socket. And while those are easily treatable back in the office, it is pretty painful and necessitates additional visits in the office. So we give you a list of what to do to try to not get that dry socket. Some of those highlights are no smoking, so hold off as long as you can. I like at least a week minimum of no smoking, but if you have to, try to keep it to a minimum, and just know that your chances of a dry socket go up, and also your healing process slows down. So my patients that do smoke after surgery typically report more pain, more discomfort, and just delayed healing. You want to make sure you don't do any strenuous exercise. You don't want to create any sort of suction, like sucking through a straw. We don't want you spitting, and we want you to avoid hard, crunchy foods. As far as pain and discomfort after the surgery, if you were prescribed any medication, please take those as directed. If you were given an antibiotic, please take that from start to finish. And if you're given pain meds, typically the narcotics are every 4 to 6 hours or as needed. And you also might be prescribed something like an anti-inflammatory, like ibuprofen or something like that. So take those as directed. You might experience some swelling at the site of the extraction. You might find that your face swells a little bit in particular areas. Ice packs for the first 24 hours. 15 minutes on, 15 minutes off. The more you ice it throughout that first day, the more that's going to control the swelling, and that also will help reduce pain and discomfort. Actually, after the first day or so, you can actually start using moist heat on your face. Again, 15 minutes on, 15 minutes off, and that will increase the blood circulation, which will improve the healing process. As far as food and diet goes, again, a lot of that's just kind of common sense. You want to avoid the hard, crunchy stuff. Chips, peanuts, sunflower seeds, those sort of things are a no. Try to go easy, but definitely make sure you're still getting enough calories and enough protein, and definitely stay hydrated. That will all increase the healing process. And then finally, keep brushing and flossing your teeth. You want to be just a little extra careful around the extraction site, but you do want to make sure you're not neglecting the rest of your oral hygiene needs and care. So that's pretty much it, guys. Again, it's all written down here for you. So if you still have any questions or need further assistance, you can call us, you can text us. We are always available here to help, and I hope your recovery goes well. Until next time, thanks a lot.